In the wake of the rising cases of deaths occasioned by drugs and substance abuse, the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, is now calling on the government to increase resources to support its agenda to eliminate the crisis. This was disclosed during the official launch of its 5-year strategic plan for the year 2023-2027 period, which brought together various stakeholders towards the cause. While alcohol was listed as the most socially abused drug substance in Kenya currently, officials also disclosed that this year alone, NACADA seized 70,743 litres of counterfeit alcohol and closed 15,538 alcohol outlets and 381 shisha joints. The authority also confiscated 6,047 kgs of bang, and a total of 29,898 arrests were made.
We have managed, in collaboration with NACADA, to conduct 61,769 raids that saw the seizure of 342 and 88 litres of changa and 2,553 and 108,000, I'll take that again, 2,553, 108 litres of kangara were confiscated.
It was further noted that the worst affected regions were in Rift Valley, Nyanza, Western, Central and Nairobi. Drug use and abuse in the country was also identified to mostly affect the youth, especially in learning institutions, with statistics showing the average age of initiation into alcohol being 16 years.
40% of alcohol users are youths, with 1 in every 7 Kenyans aged between 25 and 35 years, totaling to 1,137,288 currently abusing alcohol, with over half being addicted, and that half amounts to 596,336,000.
On March 16th this year, the government declared alcohol and drug abuse as a national security threat. While this stands, the authority revealed that almost 4 million Kenyans were in need of rehabilitation support.
Key result areas such as sensitization of 10,021,630 parents on positive parenting, also developing guidelines targeting learning institutions, and partnering with county governments and other stakeholders on matters rehabilitation and support for victims of alcohol and substance abuse, as well as outreaches aimed at protecting citizens from illicit substances and drugs.
Calls have now been made to the government to increase allocation of funds in a bid to implement the plan.
When we work out our programs, as per our strategic plan, Chief Guest, we realized that we require 12.2 billion Kenya shillings at least to make an impact when we look at our strategic plan. And therefore there is a variance of about 6.2 billion. These are variance which we would expect our partners, the civil society, other government institutions, international partners as well, individuals even at the private sector, to chip in.
Gertrude Burgay, K24 TV.